Hello and welcome to today's Campus Grand Rounds, a day in the life of an epidemiologist. My name is Nicole Dutra. I'm a senior project coordinator for the National Environmental Health Association, and I will be your moderator today. As we provide a moment for everyone to get logged in, please use the chat function to let us know where you're joining us from. Allow me to quickly review the agenda for today's Campus Grand Rounds. To begin, I'll review the learning objectives for today's seminar. I will provide a few brief announcements, and then I'll introduce our expert speaker who has a great presentation planned for all of you today. We will hold a short Q&A session after the speaker's presentation for any audience questions. Then I will introduce our panelists who are going to share with all of you a day in their life in epidemiology. Following that, we will hold a main discussion and Q&A session. And lastly, NEHA's Adrian Gothard will address all students with an opportunity. Then I'll close out today's seminar with some final announcements. After attending this seminar, you will be able to explain the various roles and responsibilities of an environmental public health epidemiologist. You'll be able to compare and contrast the responsibilities, challenges, and rewards of being an epidemiologist in the different fields of environmental public health programs. And you'll be able to assess whether a career as an epidemiologist aligns with your personal interests, skills, and professional goals. With that, allow me to cover a few housekeeping items before we get started. Please note that the seminar is being recorded. The seminar recording will be uploaded onto NEHA's Environmental Public Health Campus Grand Rounds webpage. You can also find recordings for all of our previous seminars here as well. We will drop the link in the chat for you in just a moment. Please use the Q&A option on your screen to submit any questions for our speaker and panelists. You should see the Q&A option on your Zoom screen. At the conclusion of the seminar, you will receive a link to take part in an evaluation survey to provide your feedback and Now, for those of you who may not be familiar with NEHA, allow me to provide a brief overview of who we are. As an association, everything we do is to build, sustain, and empower the environmental public health workforce so that they're equipped and prepared to protect the health of communities across the country. NEHA supports the environmental public health workforce by striving to provide the most up-to-date trainings, tools, and resources across the many fields considered environmental public health. NEHA supports building workforce capacity, efficiency, and effectiveness by focusing on increasing knowledge, skills, and competencies across all environmental public health fields. We have a registered environmental health specialist, or REHS credential, and our certified professional food safety, or CPFS credential, and there are many more. Our credentials are evidenced through our testing and maintained through continuing education. So if you are not already a member, you should join us today. We will drop the link for membership in the chat for you in just a moment. In addition, we host an annual educational conference and exhibition, which includes hundreds of sessions focused on all the different fields of environmental public health, like food safety, private water, on-site wastewater, vectors, climate, air quality, emergency preparedness and response, body art, and so many more. This year, we're hosting our AEC in Phoenix, Arizona on July 14th through the 17th. This year's conference promises to be your oasis in the desert. Registration is currently open, and in fact, you can get early bird registration pricing through April 25th. Full conference rates include tickets for our exhibition grand opening and our networking event. Now, without further delay, allow me to introduce our guest speaker. Jackson Ward is an epidemiologist for the Johnson County Department of Health and Environment in Kansas, where he specializes in environmental epidemiology, vital statistics, and syndromic surveillance. He received his Master of Public Health in epidemiologic and biostatistical methods for public health and clinical research from Johns Hopkins University in Baltimore, Maryland. Prior to his MPH, Jackson was a member of the Centers for Disease Control and Prevention's Public Health Associate Program, working in environmental health and public health emergency preparedness programs in Clay County, Illinois, and as a communications liaison to the Pacific Islands during CDC's 2016 Zika response. Jackson is a graduate of NEHA's Environmental Health Leadership Academy and currently serves on NEHA's Informatics Committee, as well as the Kansas City Metro's Climate and Environment Council that guides the implementation of the Kansas City Regional Climate Action Plan. He is also the Kansas chair of the Kansas City Data Collective, a working group of local epidemiologists and public health data experts. Jackson's environmental epidemiology interests include the intersection between climate and health, environmental justice, One Health, and vector-borne disease. So Jackson, I am going to pass the torch to you now. I will stop sharing my screen so that you are able to share yours.
Sure. Thank you.
Of course.
All right. How's that? Not on presenter view?
Yes, you're perfect. Go.
Perfect. Okay. All right. Well, good afternoon, everyone. My name is Jackson Ward, and I'm an epidemiologist with the Johnson County Department of Health and Environment in Johnson County, Kansas. We're a community about 600,000 residents or so on the Kansas side of the Kansas City metropolitan area. I'll be your speaker today for the day in the life of an epidemiologist. So what exactly is the field of epidemiology? When we break down the roots of the word, it tells us epidemiology is the study of what is upon the people. Epidemiologists study how diseases are distributed in populations and what factors influence or determine that distribution. We use data to tell the health stories of our communities that we serve in, and this can be achieved in a variety of ways using both descriptive and analytical study designs. Descriptive study designs are often used by applied epidemiologists working as public health practitioners like myself, and they focus on the person, place, and time aspects of disease occurrence. They answer the who, what, where, and when questions about diseases, and they're great for hypothesis generation. Analytic study designs are used to test these hypotheses, and they require more resources and methodological and statistical know-how. They answer the why and the how questions about disease causes, the risk factors for those diseases, and methods of transmission. These questions assist in things like determining the extent of disease problems in the community, investigating the etiology of diseases and their modes of transmission, describing the natural history of disease throughout our life course, and developing the basis for prevention programs and the evaluation of these programs. Environmental epidemiologists do all these things like epidemiologists working in other subject areas, but with a focus on the environmental exposures we experience during our lives and the outcomes and health conditions associated with those environmental exposures. We work in collaboration with a multitude of public health professionals, both in the environmental health space and outside of it, from toxicologists, environmental scientists, policymakers, and other cross-sector partners. So as environmental epis, we're always looking at how the things we're exposed to in our environment impact our health. We look at associations between the environmental exposures and things like the air we breathe, the water we drink, chemicals and noises we're exposed to in our communities and our built environment, and the climates in which we live, and that affect our likelihood to experience associated downstream health outcomes. For example, things like asthma, heat-related illness, environmentally linked cancers, and more. So this next step, I'd like to share with you a little bit more about my journey through public health and how I became an epidemiologist. So my public health journey started during my undergraduate degree at the University of Wisconsin. I, like many people working in public health, thought I wanted to practice clinical medicine. I wanted to be a doctor. But after taking coursework in public health and being taught by some really awesome people, I started to realize that I really connected with the mission of public health much more directly than clinical medicine. I liked that upstream population-wide approach to preventing complex health problems rather than more of that downstream focus on treatment that clinical medicine does. So after graduation, I took a 2-year fellowship with CDC's Public Health Associate Program, which is a great program aimed to get recent bachelor's and master's graduates frontline, boots on the ground public health experience at state, territorial, and local health departments. So like Nicole mentioned in my bio, I was assigned to a small rural health department serving a community of about 14,000 people in central Illinois. And I worked in environmental health and emergency preparedness programs. So I did the work of an environmental health specialist doing things like retail food, septic, and geothermal well inspections. But I also did West Nile virus, mosquito, and bird surveillance and some tobacco cessation work, among some other things. One of the highlights of my PHAP experience was assisting with the Zika emergency response. So I was temporarily reassigned, like CDC does when you get a public health emergency response, where they'll reallocate and shift around some of their staff to meet the needs of the response. So I got to serve a few months at the Emergency Operations Center at CDC HQ in Atlanta, serving as a regional desk coordinator for the Pacific Islands, so American Samoa, Guam, and Northern Mariana Islands. So my job was to stay in constant contact with the field teams in those on the islands and compile situational reports about new cases, existing cases, and then any supplies that might be needed to get transferred and shipped out to the islands to help with the response. My tenure at the EOC introduced me to the role of field epidemiology and applied epidemiology, and it influenced my graduate coursework when I went and got my master's in public health and epidemiology at Johns Hopkins. It steered me towards my current role as a local epi for Johnson County, where I've been for the last 6.5 years. So an epidemiologist's toolkit contains a variety of data sources, collection methods, analytical tools, techniques, and software skills. Here on this slide are just some of an example of the many resources or tools we may use. So we may use data capture, survey tools, and database management software like REDCap, environmental monitoring or biomonitoring tools like Purple Air or EPA air monitors to collect air quality data, or we might access existing databases like electronic health records or syndromic surveillance data. We use statistical analysis techniques to describe, track, measure, and analyze exposures and outcomes through means like regression analyses, predictive modeling, exposure and risk assessments, and case investigations using technology and software like spatial analysis, GIS tools like ArcGIS Pro, statistical analysis software like R, Python, SAS, or Stata, and data visualization software like Tableau to create dashboards to provide insight into the occurrences, conditions, and measures of health. These are things like measuring vital statistics, births and deaths, disease incidence and prevalence, and their associated risk factors, exposures, and causes of health conditions that we use to evaluate the effect size, efficacy, and generalizability of public health interventions. Environmental epidemiologists can work in a variety of settings depending on their specific area of expertise in both public and private sectors. You'll find us in local, state, and federal health departments like the CDC, FDA, NIH, academic and research institutions, in the healthcare system, private industry, consulting firms, non-governmental organizations, and international health organizations like the Red Cross or the World Health Organization. On this Grand Rounds today, we're focusing on public sector environmental epidemiologists, and we'll share a bit of our work experience at both the local and the state level. So epidemiologists at a local level, at cities and counties like myself, tend to have roles that are much more general than at a state health department or a federal health agency. We serve smaller and more localized populations, and we generally work in jurisdictions with fewer programs, smaller budgets, and alongside fewer staff. Not all county health departments are lucky enough to have an epidemiologist on staff, especially one that focuses on environmental epi or social epi rather than infectious disease prevention or infectious disease epidemiology. For local departments that do have EPIs, we often wear many hats, and we don't always live solely in one specific program area, which is true for me. Well, I take on the work of answering many of our community's environmental epidemiology questions. I also analyze things like our community health assessment data, which is necessary to maintain public health accreditation status, as well as portions of our vital statistics analysis for births and deaths, syndromic surveillance for a variety of health conditions. But I also am in charge of assisting other divisions across our department to meet their statistical questions and their needs. I'm also responsible for responding to community data requests among a variety of other tasks. So every day is always different. I'm not just an environmental epi, and I'm constantly bouncing around. So if you like a very dynamic work environment, a local epidemiologist is probably a great spot. One of the challenges of local epi are the data limitations that we face. Because of our smaller jurisdiction sizes, we typically struggle with small sample sizes for analyses and low event frequencies for rarer health outcomes. We may not have access to the same data sets as some of our larger agencies, and even when we do, our smaller geographies and population sizes often mean it's more difficult, if not impossible, to distinguish differences in our community across geographies like by neighborhoods or zip codes, or demographic differences across things like sex, age, or race and ethnicity. So to do a lot of these analyses, we've got to be really creative and flex our skills. So it's a really cool, challenging dynamic. For example, if I wanted to look at the impact of low air quality or high ozone days on asthma-related emergency department visits, well, I can look at changes over time and how changes in air quality are related to an increase in the incidence of asthma events in the county as a whole. I can't easily point to things like differences in air quality by zip code, or how our county's population, we might not have enough cases on a daily or weekly basis to assess the differences in risk or in frequencies between different demographic groups and being able to differentiate between them. One perk of my role at a local health department is my ability to be engaged in the community and work alongside the community in which I live. It offers me opportunities to engage in unique projects that I might not be able to do at a federal or state level, and I get to actively be paid to be involved in my community's work. While the general lack of hyperlocal environmental data poses its own set of challenges, it also means that sometimes I get to develop studies to collect these data myself if I can find the funding. One of my proudest achievements in my career has been my coordination of an urban heat island mapping campaign in August of 2023 as part of the National Oceanic and Atmospheric Administration and Kappa Strategies Community Heat Watch program. That's called Kappa Heat Watch. I co-led a community-led project where over 200 members or community member volunteers drove over 300 square miles of our community collecting temperature and relative humidity measurements that were then used through modeling software to create heat island maps that show the temperature disparities within our community over the course of the day. We identified multiple heat island areas for intervention and identified neighborhoods that at a single point in time were nearly 12 degrees warmer than surrounding neighborhoods with protective built environment factors like heavy tree canopy, which can help cool the ambient air. Over areas with more heavily developed areas with lots of concrete and parking lots and more urban areas that tend to absorb the heat and slowly release it throughout the day, leading to warmer neighborhoods. As part of my role, I also get to serve on the Kansas City's Climate and Environment Council. It's a collaborative, action-oriented committee that guides the implementation of the Kansas City Regional Climate Action Plan. We determine what topics or areas of climate change response and sustainability initiatives that we take on. And it's just really cool because as someone that's an epidemiologist, I'm not an expert in a lot of like urban greening or certain infrastructure places that make things more sustainable or reduce energy burden, which can also improve or make us more resilient to climate change. So I get to learn a ton on that council where I more provide like the health aspect of climate change. So these photos on the screen are just some photos of a few of the volunteers on our campaign. And then you can see attached to some of the windows on the vehicles, those were the temperature monitors that were attached. So they took hundreds of thousands of data points over the course of the day. Like every second it took location, temperature, relative humidity that all got put into our models that created these final maps that look like what's on the screen right now. So this is an example of our evening area-wide model. So this was our 7 to 8 o'clock, which is typically when we see a lot of that impact from the urban heat island because, well, areas with lots of green space are releasing heat more naturally from things like all of the green space. Those concrete areas tend to slowly release it, and you see that huge disparity. So as you can see here, those red areas in our community were the areas that really suffered from that urban heat island effect, and the bluer areas to the north were areas that tended to be much cooler overall for those communities. So how can you become an environmental epi? Well, different roles in workplaces require different skills and competencies. General qualifications and skills required of epis include a master's of public health, like an MPH, with a focus on epidemiology. That's the most common advanced degree, but masters of science in epi or masters of science in public health degrees are also available. People seeking higher level positions in academia or research often require doctoral degrees like PhDs. Those seeking higher positions in public health practice, like health department directors, often seek Doctor of Public Health or DRPH degrees. Successful epidemiologists have a variety of skills in their tool belt. We're experts in analytics with the ability to analyze data, interpret results, identify patterns, trends, and potential causes of health issues in populations. We have a strong statistical skill set with proficiency in using statistical software like SAS, R, SPSS, or Stata that helps us manage, analyze, and visualize data. We understand biostatistics to apply all of our statistical methods. We need to answer the public health research questions, things like regression analyses, survival analyses, and risk assessments. We have a strong foundation in research to understand study designs, and then also systematic reviews and meta-analyses that allow us to read what's available and already been researched to help us design our studies and improve upon what's already been done. And then, of course, we need strong communication skills to ensure our work can be presented clearly and concisely to a diverse group of audiences like policymakers, healthcare providers, but also that what we learn can be shared with the general public. My number one tip for aspiring EPIs is to remain curious and ask lots of questions. By far, the most valuable skill I learned in epidemiology training was not learning to code or build and interpret statistical models. It was learning how to think critically about the interconnectedness among variables and how they relate to an exposure and outcome of interest. It's this skill that prevents us from shoddy model making, haphazard assumptions, and really poor interpretations of the true relationship between exposures and outcomes. So environmental epi is a rapidly evolving field, and some emerging topics in environmental epi include the intersection between climate change and health. For example, extreme heat events are becoming more frequent, and their impact on mortality, heat-related illness, and cardiovascular diseases is one of the primary areas of study that I do in my community. But in addition to extreme heat, we're also seeing an increase in other extreme weather events and their associated health effects. Flooding, hurricanes, other climate-related disasters, including waterborne diseases, injuries, and mental health issues are all emerging topics. And climate change in general is also increasing our global risk for vector-borne disease. So changing climate patterns influence the distribution of vectors, the mosquitoes and ticks, and then the diseases that they can spread, like malaria, Zika, or Lyme disease. You may have also recently noticed an increase in public awareness of forever chemicals, like per and polyfluoroalkyl substances, PFAS. The health risks associated with exposure to these chemicals used in things like nonstick cookware, water repellent fabrics, firefighting foams, include links to cancer, liver damage, and immune system disruption. There has also been a substantial amount of growth in recent years in the field of wastewater epidemiology, especially through the COVID pandemic. So wastewater epidemiology and surveillance is a burgeoning field in public health epidemiology, and you'll learn more about that from Sarah shortly. The field of environmental public health and environmental epi is also strongly rooted in environmental justice and eliminating environmental disparities in health. So marginalized communities are disproportionately and often intentionally impacted by environmental health hazards, leading to disparities in health outcomes due to environmental racism. Understanding how these historical and systemic inequities in public policy, like our communities' designs, the siting of hazardous waste facilities, factories, and other pollutants contribute to health disparities in communities, and it's critical to the field of public health and environmental epi to recognize the cumulative impacts of these multiple environmental stressors on these communities. With increasing global interconnectivity and climate change, many environmental and infectious infectious disease epidemiologists are also incorporating the One Health approach into their work. So that's the interconnection between humans, animals, and the environment. So an example of one of these One Health questions and response for public health is the bird flu disease that's being spread around now, so avian influenza. And on top of that, things like understanding and combating antimicrobial resistance is also of ever increasing importance. One final area that's really popular in the field is the interconnection of environmental health, environmental epi, and then sustainability and community resilience. It's one of the things that's emphasized heavily in my department through our community, their interests, and then our Board of Health that prioritizes it in the work that we do. And so thank you for allowing me the opportunity to speak with you all today. And I've got some contact information there if you ever wanted to reach out with questions.
That was wonderful, Jackson. Thank you so much for your presentation. So Jackson, we have a handful of questions for you from the audience. And the first one is from Christine. She is asking, is there any MPH program that you could recommend? And will an online MPH degree prepare me for the epidemiology role in the future?
So obviously I'm incredibly biased with my program. I loved my program with Johns Hopkins. If you are eager to get started working faster, Hopkins is also it's like an accelerated master's program. So the MPH program is about 11 months rather than the traditional like 2 years for an MPH.
Wow.
I am not quite as familiar with online MPH degrees, but one thing I would say as you're researching is depending on where you want to work, I think applied epi, descriptive epi is the skill set we're going to use more. But if you're interested in working for a larger agency or doing more of those complex why and how questions, find a program that really emphasizes statistical methods and coding. So that's one of the things that I think stands out in some of the trainings between programs. So I would find one that really can expose you to a bunch of different coding softwares and then research methods for sure.
Thank you, Jackson. And another question for you. Do you think your background in environmental public health, like doing inspections and such, has helped and informed you with your epi work?
Totally. Certainly at the local level, because part of my job is to be responsive and help out our environmental department. So if they've got tons of questions, I can lean on that field experience and know what they're going through and know like, hey, if you're going out and doing a septic inspection, you're already having to measure a ton of things to make sure that the septic tank is up to code. You may not be thinking about XYZ. And so when that comes to things like we want to measure or track in our aquatics program, our pool inspections, well, I know what needs to be asked of or inspected at these pools, but then I also have that epi skill of database management, knowing what questions make sense to ask and how should I ask those questions or build those questions in a data collection software. So I think it helps me relate to our teams a lot more, having gone through it, that I don't know if I just jumped right into the field without having that field experience as an environmental health specialist, that I probably wouldn't be able to do the work quite in the same way.
I understand that. I would think that would be very true as well. Another question for you from Olivia. What are some different titles for environmental epidemiologists in the private and public sector?
So within environmental health, you might have air quality specialists. So environmental EPIs that focus on air quality. You might have like climate change, environmental epidemiologists, wastewater epidemiology. Pretty much if you name a topic about environmental health, there's probably somewhere a jurisdiction that focuses on that. At the local level, probably not. You maybe, if you get into like a bigger city or a bigger county, you might get someone that is a very niche topic within environmental epi. But in general, like for us, just having an environmental epi on staff is kind of a huge achievement in itself.
Yes, absolutely. Another question from Emily, what classes or subjects or skills did you find most valuable from your MPH program for your career as an epidemiologist?
Yeah, so for me, it was definitely those research methods courses and taking multiple ones, not just the ones that are required for the epi degree, but really diving in to learn more softwares, um, more statistical techniques. Pretty much like the more you can just dive into all of that, I think the better equipped you'll be to be successful. Um, I know one of the concepts, like my tip of asking a ton of questions, I think the thing that separates epidemiologists apart from just general data scientists, or certainly things like AI or ChatGPT that tries to do some of the work that EPIs do, is our ability to think about that relationship between variables. So in epidemiology, there's a concept called DAGs, so like directed acyclic graphs, and it's really just this way that we can look at all of the factors that could impact the relationship we're looking at between exposures and outcomes, and draw it out in a way that makes sense, that helps us consciously build a model in a way that properly adapts to those relationships. So that's a thing that, like if you were to just throw all of our data into like a machine learning model, it's not going to build the model the same way an epidemiologist would, with all of that personal expertise and the ability to write out and draw out that DAG. So I would say diving into training in that is going to help you be much further along in your ability to think like an epidemiologist. And I mean, for me, it's just helped me in way outside of work too, to think about problems in that way.
All right, let's see. I have time for one more question from the audience, and then Jackson, if you would address the remaining questions through the Q&A option. This next one was from Pauline. Do you think that to succeed in environmental epidemiology, the school that you attend for graduate school is crucial in getting jobs?
That's a really good question. And I think it's probably less about the school you attend. I'm sure there are certain things. I know that where I went to graduate school opened up a lot of doors and interviews and things like that. But I think, as long as you're going to a school of public health, that they're accredited, you're getting that a proper public health accredited Masters of Public Health program is going to meet the requirements to make you a well-equipped epidemiologist. I think there's probably more that you can do within a program to make yourself a better candidate in jobs than you would find between programs.
I agree with that too. Well, thank you so much, Jackson, for your presentation and for answering all the questions from the audience. I have left some questions in the Q&A for you to address. And next, I will introduce our panelists who will share a day in their life in epidemiology. So next we have Kendra Middlebrook, who is an epidemiologist at the Tennessee Department of Health's Environmental Epidemiology Program. Oh, give me one sec. There we go. Adrian, can you confirm that that screen popped up for me?
Yes.
Thank you. All right. Sorry, Kendra. Kendra is an epidemiologist at the Tennessee Department of Health's Environmental Epidemiology Program. She attained her Bachelor of Science degree in biochemistry from the University of Memphis in 2018, and her Master's of Public Health degree in epidemiology from East Tennessee State University in 2022. In her current role as an epidemiologist, she is a part of the charge leading data modernization efforts across the Tennessee Department of Health through the development of their first ever open data portal. Her work is supported by the CDC's National Environmental Public Health Tracking Program, which aims to provide constituents with data related to various subjects in environmental health and chronic diseases. And following Kendra, we will have Sarah Avalle, who is a wastewater surveillance epidemiologist for the Arizona Department of Health Services. She has 3 years experience in laboratory science along with 2 years in public health. Sarah earned her bachelor's degree in molecular biosciences and biotechnology and a master's in biological data science at Arizona State University. During her time in wastewater surveillance, she has employed various problem-solving strategies to find solutions for wastewater's unique problems and developed innovative project ideas to grow the program. In her spare time, she enjoys spending time creating adventures with her husband and 2 boys, an Australian Shepherd. So, Kendra, I will stop sharing my screen and so that you are able to share your screen. I'll let you know when yours pops up.
Okay, thank you.
Mhm.
Doing it now.
It's coming. Sorry for the delay, everyone. Our Zoom has been working just a little slow today. All right, I see your PowerPoint.
Okay. Now you can see
There
the
you
whole
go.
slide. Okay.
You're all set. Thank you.
Okay, thank you. Okay, so good afternoon, everybody. My name is Kendra Middlebrook. I work at the Tennessee Department of Health, as Nicole introduced, and I'm just going to go through how I got into public health and then what I currently do now, a couple of my hobbies and interests, and some of my achievements thus far. So, much like Jackson, as he was saying, like when you enter into public health, you start hearing about public health, or when you think about it, most people who start, they want to do medicine. So I was in this group called the Health Occupational Students of America during high school, and I really wasn't sure what I wanted to do. But I knew I wanted to do something that helps people and benefits the health of people. And so I joined this club, and I remember we had this assignment where she was like, oh, you need to pick a career within medicine and basically do a subject on like a profile on it. And I was like, I really am not interested in that. I really want to be like a detective. I want to do something with like crime scene work or something. And so that's what my teacher told me about epidemiology. And then when she told me that, she was like, it's like, huh, that is very interesting. So I did a whole project on it. And, being 15, I was just like, I just need to pass. So, this is interesting, but I still don't really have like a vested interest, right? So when I started my degree at the University of Memphis, I majored in chemistry and minored in criminal justice because I was determined to be a crime scene investigator. I knew I wanted to do forensics. I just knew in my heart of hearts that that's what I wanted to spend my days doing. And I even took a forensics class, which I picture here. We did like this assignment with like some type of simulation where we had to figure out who murdered who, like what the ballistics of it were. It's very interesting. But from this class is when I realized I did not want to do this. He would show us like real crime scene photos because he had been doing it for like 20 years, and he was telling us how we had to like compartmentalize different things in our lives. And once we delved into the subject and I realized I think maybe the morbidity of it. I don't know if that's even the right word. I was like, nah, I don't think I could do that every day. So I still finished my degree and I graduated in 2018. That's me, my graduation, my aunt and uncle. And I went through, of course, the classic, you don't have enough experience to get a job with chemistry, but you also have too much experience to just get a job, period, and anything else. So I took some time to myself. I took off about a year after I graduated, and then I started to think about doing epidemiology again. And so I applied to a few different schools in Texas, Tennessee, and I ended up getting into East Tennessee State University, where I pursued my master's in public health, and I graduated in 2022. Here's me at graduation. And I ended up getting my first position here in public health in October of 2022. So currently, I work with the environmental epidemiology department, and we have two different sections. One section deals with environmental exposures, with things such as like lead in schools, risk assessment, which is looking at sites and how to remediate them that benefit the health of the public, and making sure that people are aware of the exposures that are in their environment and how to properly take care of them. However, on the side that I deal with, we work with environmental public health tracking, which is a CDC program that allows us to build up the data capacity in our state and show environmental health trends and chronic disease trends for Tennessee on our own website. So, this program currently has about 30 states, and it's a national program that the CDC funds these different states, and they all have different data portals where they house all this information. However, we do have a standard set of data parameters that we have to abide by. I have a full list right here of what we have to post on our portal, and from this list we have to submit data on an annual basis for asthma, birth defects, unintentional carbon monoxide poisoning, COPD, heat-related illness, drinking water, and heart disease and stroke, and radon. So at least 7 of these, we have to get the data from different partners within our state, clean it to the CDC data standards, and then submit it to them for validation so that they can make sure that they meet those national standards and they get posted on a national portal where you can compare it with different states that are funded through this program. So we get this data that we need to submit from several different sources. Some are within our own health department. We have a birth defects surveillance system, and we also have a hospital discharge data system where we get our information about emergency department visits and hospitalizations. We also get data from the National Climate Education information where we get temperature data and precipitation data. The EPA provides us with data for air quality, and the Tennessee Department of Environment and Conservation, which is known as TDEC here, gives us our information for drinking water. And NOAA is where we get our other climate-related data. This is the National Oceanic Administration Agency. And here, I just pictured my coworkers here. I have 2 lovely ladies to help me within these efforts. So it's not just me doing all the work. I also have their assistance as well. So I just wanted to give y'all an example of a kind of chart that I would make with the data that I have. So what I did in this scenario is I looked at data for COPD, heart attacks and strokes, and asthma. And I basically accumulated them to see how many cases occur, how many emergency department visits occur within 2019, 2020, and 2021. So numbers that you see are the number of emergency department visits, regardless of whatever condition that I'm talking about. And when we talk about extreme heat, as it's about to get hot outside, there is usually typically a higher occurrence of people getting admitted to the hospital or going to the hospital because the heat tends to exacerbate these symptoms that they're experiencing. And so people want to go make sure they're okay. And so this trend line just shows you the percent of summer emergency department visits that happen in each year, again, regardless of those emergency department visits. And just to drive that point home, I also included a trend line that shows the number of extreme heat days. You can see, like, with more days, you typically see more hospitalizations, except in 2021. But also, again, we have to think about it was COVID, so a lot of people aren't going outside anyway. So a little bit about me. I love to read. I've been reading a lot this past year. I'm currently at about 16 books out of 35 that I'm aiming for, and I'm currently reading the new Hunger Games book. I'm really excited about that. And I really love to crochet. I made my mom this scarf, and I also made my best friend this hat here. So that's what I usually do in my spare time when I'm not analyzing any data. And I'm also a part of the Environmental Health Leadership Academy currently. And I think it's been one of my greatest achievements thus far in my career. In November, we got to go to an EDR Ops course, which is environmental health training in an emergency response. So it went through several different activities that we could use in case there was a disaster, right? So looking at shelters, making sure that the food safety was up to par, being in like hostage situations, things like that. It was very interactive, and I got to meet a lot of people who were in my cohort because they're all across the country. So it's very rare that you ever get to see them until you go to the annual meeting that's in July. And this is just me in a full hazmat suit, and I was just, doing my simulation, and it was very interactive. I had a lot of fun. And in addition to that, in Tennessee, we don't get to talk a lot about climate. It's kind of a little trigger word here sometimes. But last year, we did get to host this climate meeting with different partners through academia and also other government agencies to see how the work that they're doing can be bridged together by the work that we're doing here in the state. Like, what kind of resources do you need? How can we collaborate? How can we get this work amplified? How can we further what we're doing and what you're doing to benefit the people here in our state? So I also have my contact information here. And if you scan the QR code, it'll take you to the website that I was mentioning earlier. It's going to have our environmental health data and our chronic disease data there. We also have several different things like opioids and reproductive health. A lot of things you could think of. Just type something in and you'll see what's going on. So thank you for having me here. And I'm going to stop sharing my screen.
Thank you, Kendra, for sharing your story. Very cool. Very cool. And next we will go to Sarah Avalle in Arizona.
Apologies, my computer froze on me for a second there. Looks like it's working now.
Yes,
Okay,
you're good to
awesome.
go.
I do not have a presentation for you today, but I kind of just wanted to go over a little bit about, how I started and how I got where I am today. So I was previously a pet groomer for 12 years, and it was a really great career, but I didn't see something long-term for myself. So when I moved from Florida to Arizona, I went back to school and I had no idea what I wanted to do. I actually went back to get my associate's degree starting off, and I got my associate's in science at community college, and then I transferred to ASU. And I got my bachelor's degree in molecular biosciences and biotechnology. And like many, college students, I changed my mind several times. I took an epidemiology class and then had to drop it because I had so many courses at that semester. I just couldn't handle the workload. I never knew that I would end up in epidemiology because I hadn't really explored that as an option yet. During that time, I worked in the ASU science labs, setting up for classes. I worked on research projects in microbiology and bioinformatics. I continued, once I finished my my bachelor's degree, I went back and got a job at the Arizona State Public Health Lab as a contractor. And I was working in the virology section. And during that time, I was also went back to get my master's degree because I knew I wanted to do something with, computers, bioinformatics. I really like that coding aspect of things. So I decided to, go into this program. And so I did kind of both simultaneously. And as I continued to work through, when my contract was up, it was about a year. I wanted to find a way to get into epidemiology because when I worked at the state lab, I knew that there was this field of epidemiology and it was kind of a little ghost for me because we just sent data to them and I had no clue what they did, but it sounded interesting just from my own research that I did. So I just started searching for jobs and I actually got applied for and got the enteric disease internship with ADHS. So I transferred to the epi side of things from the lab. And it was a 6-month internship where it ended. There was an open position when that internship ended. And that internship mostly covered, I was working on laboratory-based things. So it kind of worked for my area of expertise. And I did a survey for all of the clinical labs that submit data to the Enterix team. And I wanted to look into, what they were testing, like what testing methods they were using, contact information, just general information about these clinical labs. So we had better knowledge for our epi side of things and also to get communication with the labs a little bit better and working a little smoother. And so when that internship was up, the wastewater position happened to be open because the person who's previously there moved up to be our program manager. So it was a really great opportunity. I applied for it. I got the position, and I have been learning every day since I started. As the wastewater surveillance epi for Arizona, I wear many hats. So I work on, data analysis, data management. I communicate with stakeholders, and I'm always conversating with them, trying to figure out how to work with the wastewater data. I work on project management, so I have a lot of different projects that, we have to keep on track. And then disease surveillance as well. I'm actually an infectious disease epidemiologist. However, some wastewater positions, especially in many states, are actually housed within the environmental departments. So it's kind of this weird in between land with wastewater surveillance. And it's really cool because I get to see many aspects of different things. So wastewater surveillance is, some of you may all know, I'm not sure, but it covers many different diseases. We cover influenza, COVID-19, RSV, and H5, which is avian influenza. That's currently what our state lab here in Arizona is testing for, but we're exploring Mpox testing and arboviruses. The really cool thing about wastewater surveillance is you can test for a number of things, but you have to think about, what are the implications of that testing? So if we were to choose a specific target to test for, we have to think of, what kind of public health actions could be taken from, wastewater levels within that site. And if there's not a lot of public health actions, it's not as useful for, other epi teams to be able to use this data. So it's kind of really cool. I get to do a lot of critical thinking. We get to think outside the box and to figure out what we're going to do with our data. We currently have 24 wastewater sites across the state, in many counties, but not all. Wastewater surveillance is very, very new, so we're still building our program, as are many other states. And so recruiting wastewater treatment facilities can be pretty fun. Sometimes it just requires calling them because public health and wastewater utilities are not always residing together. So I have attended wastewater conferences for actual wastewater utilities to kind of do outreach and to meet them firsthand and start up conversations about wastewater surveillance. And since it's still new, we're still kind of learning, I also do as an epi, I also assist the food and waterborne enteric disease team. And so part of my time will be split between wastewater surveillance and working on building our program and doing our analysis, and also doing foodborne surveillance. So we cover foodborne diseases like salmonella, CAMPI, yersiniosis, and many, many others, food and waterborne diseases. And so that's also really fun because I've learned many different skills. I participate in outbreak management, surveillance, and communications on the foodborne disease side as well. And this is actually pretty common within many states for wastewater surveillance, where the wastewater epi does a little bit of foodborne as well as, wastewater surveillance. So it does happen. And I have been able to complete so many projects I never thought I would be able to. I've built databases, dashboards, GIS maps, and I have a bunch of projects on the way. And, there's always going to be, new projects, new challenges with wastewater, lots of critical thinking, and, what lab methods are best, what analysis methods are best. It's a really cool thing about such a new field, is that we get to learn about all of these options and we get to explore new things that most epis don't always get to do. And then I honestly think I chose to be an epi because I want to help people. I want to make a difference in what I do. We all have to work for a living, maybe not everyone, but those of us that do, we want it to be worthwhile. And to me, that gives me purpose and meaning in what I do. And so that's why I really enjoy it. And I hope you liked my talk. That's all I have for today. Thank you.
Thank you, Sarah, for sharing your story. Appreciate that. Jackson and Kendra, if you'd like to come on camera, we could take a few questions from the audience. I have one awaiting. from Olivia. She'd like to know what are the different levels of an epidemic, like what are your different levels as a job role, and how do you advance? So whoever would like to address that question would be wonderful.
I can answer first, just based off of what we do here. We actually have, I think, up to EPI level 4. And so there's EPI 1, EPI 2, EPI 3, EPI 4. And as you go up the ladder, it's based off of years of experience, your schooling, so you know what degrees you have. If you don't have the degree, there is an option for the years of experience. So there is a way to move up even if you don't have that master's degree or that PhD. And it is, the rungs are based on, you know, experience. As you move up, you get more responsibility. So, you know, you may be managing others a little bit more. And our program managers, as far as the ones that manage our teams, are actually separate from the EPI 1, 2, 3, 4 series. So you could continue to be an EPI, or you could go the management route if you want to. But you know, there's a lot of EPIs who just want to stay in, you know, the field work. And so it gives us a really great option for it. And that was based off of the CSTE recommendations for the EPIs.
Cool. Well, I want to say that you guys have portrayed a role in epidemiology as so exciting that I'm like, wow, maybe I did like my epidemiology class when I took it. Like it sounds like your roles like are so diverse and get to do so many different things. It sounds amazing. So, let's see if the three of you would drop your contact information for the audience into chat if you have not already, that would be wonderful. There are no other questions at this time, so I'm going to share my screen again and pass the torch to Adrian. Give me a sec and I will have this up for you. Did that come up for you, Adrian?
Yes, thanks,
Great.
Nicole. So, hey everyone, my name is Adrian Gothard. I'm a program analyst here at NEHA, and my role is really to support NEHA's student and early career development initiatives. So NEHA has always had a focus on supporting the development of environmental and public health students. As we know that an estimated 40% of the environmental public health workforce today plan to leave their jobs in the next few years. So NEHA, our focus on students has become a key commitment to building the next generation of the workforce who are trained and prepared to serve their communities. So we have enhanced our focus. We offer academic scholarships for graduate and undergraduate students. And last year we gave out more than $18,000. We have a student research competition. Of course, we have our environmental health campus grand rounds that offer the opportunity for students to engage directly with experts in the field. And as we saw today, we have some really amazing speakers for these. Mentorship opportunities and access to our community of over 7,200 members. And then we have, you know, career building and professional development resources and many more things coming soon. And I wanted to mention that we are currently offering a free 12-month NEHA membership for students if you join by October 1st, 2025. So if you aren't already a member, we would encourage you to join. And I'll drop my information in the chat. If you have any questions about what NEHA does for students or how we can support you, please don't hesitate to reach out. And I will also drop the chat for our student webpage where you can sign up for free membership. Thanks, Nicole.
Great. Thank you so much, Adrian. All right, so we would like to give a big thank you to our guest speaker, Jackson Ward, and our guest panelists, Kendra Middlebrook and Sarah Avalle. Thank you so much for sharing your stories. They were amazing. And thank you to all of you for joining us today. I hope you gained new insight into the field of epidemiology. We have one final request of each of you who attended today, and that is to take just 5 minutes to provide us your feedback on today's seminar by completing our short evaluation survey. Your feedback is very valuable to us and assists us in being able to better meet your needs in future seminars. It would be greatly appreciated. You'll receive a link following the close of the seminar. Thank you again to everyone. Wishing you all a wonderful rest of your day. Goodbye.